Let's talk supplements now. Given what you're eating, anything you take on a regular basis to enhance that.
I think of supplements like medications. They are an exogenous substance that we are putting in our body to try to achieve a specific goal or target of some kind. That said, and so for most of my patients, I supplement based on either lab values or specific symptoms or particular, goals and targets. That being said, there are a couple that I think most people can benefit from irrespective of their lab values or what's going on in their life. The first of those is magnesium in the evenings to help support rest and sleep and muscle recovery. I think magnesium is great, and I think most people should probably take some. And that has, even if your diet's pretty clean, right, our soil has been depleted. And so, and it's hard to test for magnesium. We can test blood serum levels, which are almost always normal because your body will prioritize maintaining the level in our circulating blood above everything else. So you can be depleted in the muscle, depleted in the bones, depleted in the brain, and still have a normal serum level. You can measure it in the membrane of a red blood cell, but it's hard to know how well validated that test is. So I don't think that that's super reliable. The most efficient way, or like the best described way to test for magnesium deficiency has been done for experiments, but it's not done clinically, which is a magnesium repletion, where you give people a bunch of IV magnesium and you see how much of it they absorb. And if they absorb a lot, then they were deficient. That's the assumption. So that's not something that's really ever tested clinically, but it's pretty harmless to take. So as long as you're taking kind of a chelated version, so that's a bisglycinate or a glycinate, a threonate, a taurate, the ones that are a little harder on our digestive system would be mag oxide, mag citrate. Those ones are likely to cause some GI upset, so I tend to avoid those and stick with the chelated ones. But if you take too much, you'll pee it out. It's not a huge concern. So I think magnesium is a great thing for anybody who's got leg cramps at night, anybody who's got some muscle soreness from excess training, and anybody who wants a little bit better support for restful sleep. So magnesium is a big one for me. And then creatine is the other one. If anybody is doing resistance training, and everybody should be doing resistance training, then I want you on at least 5 grams of creatine a day to help you support that. The higher doses of creatine that have been discussed for brain health are interesting. I think there's much less data for that, but I anecdotally have tried it for myself after periods of sleep deprivation or jet lag, and I think it seems to be helping. I can't rule out a placebo effect there, but I do double or triple up my creatine on days where I, if I've been up all night operating or severely jet lagged, something like that.
One of the supplements you often hear connected to the blood is fish oil, and in terms of thinning the blood. So any truth there, and then any value there?
This is a complicated story, and it's very interesting. The omega-3 fatty acids that we are trying to improve are the DHA and EPA. And that is what is delivered in sort of fatty fish. It's what is in the krill oil and the fish oil supplements. And there are a bunch of different stories here. So one is cardiovascular health. And there have been some studies that have looked at a prescription version of EPA, which is the one that's most associated with cardiovascular inflammation and vascular health. And for patients with elevated triglycerides, that 4 grams a day of EPA was, in a randomized clinical trial, shown to be helpful in reducing cardiovascular events. The couple of issues with that study were the sham version of the placebo-controlled arm was I think it was corn oil, so it was perhaps a little pro-inflammatory, so we can't rule out that was actually, maybe the EPA didn't help, but actually the corn oil hurt, so that's one option. The other thing is that it increased risk for atrial fibrillation, which is an abnormal heart rhythm that can be pretty serious for people who develop it. It might require them to be on blood thinners or have procedures to try to restore a normal heart rhythm. So at higher doses, the fish oil or the omega-3 fatty acids in particular seem to increase the risk for atrial fibrillation. So we have to be a little bit careful about who we're using it in. And of course, we in this space will know that many people can manage elevated triglycerides with a different nutritional strategy, and perhaps medicating that is like the least effective way to deal with that problem. So that's another point I will say about that. Most people, even if you're taking 4 fish oil capsules a day, are not going to get 4 grams of EPA. The DHA component of your omega-3 capsules, whatever they are, can also increase the LDL cholesterol, which is why the lipid people went with EPA only. But the one that's important for brain health, the one that's in our neuron membranes, is the DHA. And so DHA is actually what people who are ApoE4 positive are thinking about supplementing more of. And people who are interested in the brain health component are actually preferentially interested in the DHA of those 2, primary omega-3 fatty acids. And it seems to be important how we deliver these fatty acids as well. So your average supplement the fatty acids can be packaged in different ways. So just think of it like different envelopes that you're sending stuff to your friend across the country, right? You have your little postcard, you have a regular mail envelope, you have one of those padded mailers, or you have a big box, right? So there's just different packaging, but you can put the same letter to your friend in all of those different packages. So fish oil capsules can be as an ethyl ester, they can be a monoglyceride or a triglyceride form. They can also be in a like a phosphatidylcholine form. And for people who have brain issues like an ApoE4 that may have damaged the blood-brain barrier, this PC version, phosphatidylcholine version, which is also more common in eaten foods like the fatty fish that we eat, seems to go better into the central nervous system. So, if you're getting an omega check or you're getting a lab value that's measured by your doctor for your omega-3 levels, that's what's in your blood. But we don't know that that's actually getting into the brain. So if brain health is your consideration, you may want to think about more DHA. You may want to think about how it is packaged to try to get into the central nervous system more effectively. The guidelines are no longer recommending fish oil supplementation for people for cardiovascular health, partly because of the risk for atrial fibrillation, partly because the commercial supplement products are very unreliable in terms of dosing, and they are trying to drive people to the very dose-controlled prescription versions. Icosapent ethyl is the one that was in the trial that we talked about earlier. So that being said, if you're interested in supplementing, then you just need to be very conscientious about how you're getting your omega-3s and making sure that they're not oxidized, making sure that they've been tested for heavy metals and all of these things. Or you're doing sardine fasting or supplementing with sardines and fatty fish in your diet. Perhaps that's the most effective way if we can do it.
Since you made it to the end of this clip, I know you're going to love the full episode. Click here to watch. I'll see you over there.
I, as a vascular surgeon, predominantly see people who've had a problem already from plaque. Why do you have plaque? Is this an inflammation problem? Is this a lipid problem, an insulin problem? Where is it?